Talking about the deaths that are caused due to the surgical procedures, or even we can consider and take into account the deaths that are caused due to the local anesthesias or even the general anesthesias that are given during the surgical procedures, can prove to be fatal for different individuals. So over here, the topic of discussion that we are going to discuss, and that is the crux of this lecture, is the modes of death and the causes of death while we are considering the deaths that were caused due to the surgeries. So over here, it's again very important that we take into account whether such the surgical procedures are of importance or are of vitalities or not. So over here, we are going to discuss all of the causes and the underlying risk factors whenever we are considering to perform surgery on a particular person. Now, as a routine and as a practitioner, as a forensic practitioner, or even a surgical procedure, if it is being carried out and you're working as a surgeon or as a medical legal officer over there, you're going to carry out the complete history on the particular person. The drug history, the family history, the allergic reactions, all of these have to be taken into account whenever a surgical procedure has to be performed on a specific person. Now, there are a lot of anaphylactic reactions that come into play whenever different drugs are given or administered, whether they are given orally or intravenously or intramuscularly, and a certain person can react to a certain drug in quite a fatal way. So the past history is very important and is of vitality over here. Again, the drug reactions are very important, and one has to have a complete family history of that particular person on whom the surgery has to be performed. So all of these precautions have to be taken, and even after these precautions, a consent form is signed on part of the relatives if the person on whom the surgical procedure is being performed is unconscious and he's not able to sign in his own consent form, or if he's a minor or if he's in a mentally disabled state and he's not able to make decisions for himself, the consent form has to be signed by the relatives or by whomsoever are the caregivers of the particular patient. So all of these vitalities are very important when you're working as a surgeon and you're considering that deaths can occur on part of the negligence of the doctor. But sometimes the doctors are innocent, and if you want to advocate yourself that you were innocent, you have to basically follow this whole command that you have to sign the consent form from the relatives or the person himself. So these are all the risk factors that have to be taken into account whenever we are considering deaths that were caused due to surgery. Now, in this section particularly and specifically, we are going to discuss the modes and the causes of death that were caused due to the surgical procedures or due to the anesthesias, whether it was of the local kind or whether it was of the general kind. So first of all, we are going to discuss the causes of death in detail over here. And moving on, we'll be discussing the classification system for deaths during the surgery. It's again very important that we classify the deaths that were caused due to surgery, because there are multiple causes, there are multiple risk factors for such deaths, and so we'll be discussing them in detail over here as well. Now, deaths due to the disease or the failure of the surgical technique is another thing that we have to take into account. It can be some pre-existing disease that was already there and that basically complicated the situation after the surgery. So even all of these pre-existing diseases are basically evaluated, and sometimes they are digged out on the they are digged out after the investigations are being carried out, and the investigating officer basically gets a complete case history of a particular person, and he involves the hospital staff and the nursing staff as well while he's carrying out his investigation procedures. So all of this is basically discussed over here. Moving on, basically, we'll be discussing the modes and the causes of death over here. Now, first and the foremostly, basically, it is the disease or the injury for which operation or the anesthesia was given. or it was being carried out. So it's again the main crux over here, and we are going to basically focus over here that on whatever on whatever condition the surgical procedure was performed on, this debilitating condition can itself prove to be fatal for a particular person. Now, the diseases or abnormalities other than that for which the procedure was being carried out. So even we have to take into account the other diseases or the other abnormalities that are the pre-existing conditions. For example, it can be the diabetes mellitus, or it can be any other chronic diseases, for example, hepatitis B, C, if one is suffering from, or it can be hypertension. So all of these diseases have to be taken into account over here. Now, the mishaps during or a complication of the surgery or the diagnostic procedure, they're again very important, just because of the fact that if a particular surgery was performed, and say, for example, it was performed on the intestines were strangulated by some kind of a forceps that was left over there, and it was neglected by the surgeon whosoever was performing the procedure. So again, this is going to be the neglect on part of the surgeon. So even this reasoning is fair enough, and it has to be advocated upon if the clinician is found to be guilty over here. So the fourth point consists of the mishaps during or the complications of the anesthesia being administered. So it can be basically anaphylactic reaction or a drug reaction to the anesthesias, whether it was a local anesthesia or whether it was a general anesthesia that was given during the surgical procedure. So all of these can prove to be fatal for a particular person only, and basically we'll just weigh the risks versus the benefit ratios over here and perform the surgeries on a particular person in a particular case. Now, the classification system, this is basically according to the American Society of Anesthesia. So it is basically abbreviated as ASA, and they give basically the 5 classifications for this. No serious disease is found, it is the ASA1, and if we have a serious disease but have no limitations on their activities, it is the ASA2. ASA3 is basically the serious disease and some limitations of their activities. ASA4 is basically when there is a serious disease that is constant threat to their health, and it basically limits the activities of the person. The ASA5 basically includes a serious disease that their death can be expected within 24 hours with or without the treatment. So this is basically a classification on which the society basically decides whether the investigation has to be carried out or not. And basically the deaths that basically lies between ASA1 and ASA2 are the deaths that have to be investigated in particular, because in these groups, basically, there are no serious diseases that the person was suffering from. Would death have occurred when, if the operation had not taken place? So this is a very important question that a surgeon or working as a forensic practitioner, one should ask whenever one is carrying out investigation in a particular death, whether the surgical procedure was vital enough to perform or not. Now, this is basically a toll that is showing the deaths resulting from the delay in the medical care or surgery, and you can see that the toll rises for a no. That is almost 62 deaths occurred when no surgery was being carried out. Whether or not the operative procedure is justified, it's again the topic of discussion and topic of debate whenever we investigate different cases. Now, it can be a failure of surgical technique itself that can cause death in a particular case. Anatomical abnormalities have to be reported, and while writing down the autopsy report, you have to write down whether there were any failure of the equipment found, and you have to see whether the endotracheal tube is in place or not. We have to look for the error or incompetence as well on part of the doctor. So in this section, basically, we dealt with the modes and the causes of death whenever we are considering deaths that were caused due to the surgical procedure. So that is the end to this section. Thank you for watching sqadia.com.